to another episode of Flipping Founders. My name is Khushi and I'm really excited for you all to see the next episode. I hope you find it helpful. Enjoy the show. On today's episode, I am joined by Dr. Vipender Sabherwal. He is a renowned surgeon and a healthcare innovator. With more than 20 years of experience in laparoscopy and laser surgery, he has performed over 10,000 successful procedures. He is the managing director of Jeewan Hospital in New Delhi. His expertise and leadership have been instrumental in establishing the hospital as a leader in advanced medical treatment. He also has impressive credentials that reflect his commitment to excellence, including a master's degree from University of Edinburgh, MBB, MS Surgery with a gold medal, DNB, MNAMS, and FICS from Chicago. Moreover, his impact transcends the surgical suite as he serves as an international faculty member at Johnson & Johnson, where he lends his expertise to shape global healthcare standards. He is also a board member of Delhi University's governing body of council, and his past service includes Police Mitra. His contributions have been recognized on numerous occasions, including being honored as a special invitee at the G20 Medical Summit and being hailed as the most promising laparoscopic surgeon by the Delhi Minister of Global Medtech. His dedication to social service and academic excellence has earned him prestigious awards such as the BS National Conclave Award, Health Icon Award, and the Human Care Award of Excellence from the Delhi Medical and Dental Society. Dr. Saberwal's multifaceted contributions to the medical field reflect his unwavering commitment to advancing healthcare standards and inspiring the future generations of medical professionals. He is also carrying the legacy of a family with 150 doctors from the last 4 generations. Today, join me as I delve into Dr. Vipender Sabherwal's journey and gain some insights into the Indian medical infrastructure, leadership, and the transformative changes shaping the future of healthcare in India. Welcome to Flipping Founders, Dr. Sabherwal. I'm really excited to have you here.
Thank you so much for having me here.
Now, moving on to the first question, what inspired you to pursue a career in surgery?
I think one thing they always say that sometimes some things are in your genes. But I think when I was born, I only saw medicine. And it's a family of 150 doctors and we've been practicing medicine for 100 years. So I was blessed to be born in that family. But it was not only that I had seen people working, but I had seen the patients coming. And the blessings they used to give, that really inspired me. Those blessings inspired me. And definitely the way my parents and my grandparents, they used to deal with the patients, not as just like somebody just coming for a work, but somebody they wanted to give everything.
Right. No, that's lovely. And then can you share a bit about your journey from the time you got your medical qualifications to now where you are the managing director of Jeewan Hospital?
Right. So God has been very kind to me, as I was born in this family and then I saw all this and then I was inspired to become a doctor. And then the journey started when I got my admissions and I was in the medical college and I could do very well in my PGIMS. And then I was lucky to get my gold medal in my MS, the Masters of Surgery. And then I was inspired more, It's like when you keep on having good things and God is with you, that inspired me more because I always wanted to become a surgeon. And that too because I thought that's the best way to heal somebody and to immediately, do something good for someone. So then I got inspired to do more and then I did my Masters from Edinburgh Royal College of Surgeons. And the experience of the Edinburgh Royal College was again very amazing and very global. That impact was so much on myself. Then I did my fellowship from Chicago. So, I think it was a good virtuous cycle for me, One thing led to the other and kept on inspiring me. I did my DNB also. I did so many degrees and I kept on learning. So I just understood that the more I learn, the more I can give. So I think that really inspired me.
Oh, that's a very nice. And with over 20 years of experience in surgery, what all changes have you witnessed in, the Indian medical infrastructure?
I think the changes are immense, because when I started, so I was in Safdarjung for a few years and it's amazing. It's one of the best hospital I would feel, even for a surgeon to learn and to see things. And we were doing I was doing maybe 14, 15 surgeries in one evening, night, and just going through that cycle to learn, and the faculty was so good, and the number of patients are so immense there. So that was the time when we were doing all open surgeries. Even surgeries like my intestinal surgeries, I do all gallbladders, hernias, different, all related to the hepatobiliary. So we used to do a lot of open surgeries, and then the time changed, and the time changed when we wanted to do minimal invasive, and that minimal invasive was also catching up. And then I started my laparoscopic surgery, which was so beautiful. As everybody knows, it's called the keyhole surgery. So just through those small holes, we could just venture inside, and with the latest technology, started doing surgeries through that. And the best thing I noticed in that was the patient care, the post-operative. First thing, the patient was not scared of those scars. Then we were not doing everything by hand. We were doing with those small instruments. And this helped in the post-operative care, and it was so nice, I still remember those two lines when somebody told me that, कभी हम मिले भी तो क्या मिले, वही दूरियां वही फासले, ना तुम्हारे कभी कदम बढ़े, ना कभी हमारी झिझक गई. So that was the hesitation patient used to have. Okay, sir, surgery, no, I can't have a surgery. But then these things started catching up, and then I became master of laparoscopy, and I became the faculty. So I was teaching also the new techniques, and that's how the journey kept on going, and I'm very happy that how it's shaped.
Yeah, and I also think, someone who's doesn't have a medical background, I think over the years, our faith, the common man's faith in the Indian medical, infrastructure has also been increased. Because when you go outside, people have different sort of, health infrastructures and everything. And I think worldwide, medical tourism in India has also become a thing. And I think it just speaks to, the hard work of all the surgeons like you who work so hard that now, there are people outside the NRI committee, they're like, no, we trust Indian surgeons. We will go back and we will get our surgery done in India. They have the best patient care, and then we will come back.
I think this is very true. What you're saying is you've done your thing. I mean, that's very, very nice. I just had an experience of G20.
Right.
So I was very blessed. We were invited specially as a Jeewan family. I represented that because of that 100 years thing. And we were there for about 3 days. I met Mansukh Bhai, the health minister, and a lot of people from different ministries. I could talk to about 40 to 50 countries. And we had MOU signed with them, and they are very, very surprised, but they are very happy also, that the faith and trust has increased. So we had so many people from Europe, from Egypt, from South Africa, from Nepal, Bhutan, Burma. There's so many countries, and they have that trust. So they want to come to India because I think it's gone very much global.
Yes.
And people are trusting our technology. People are trusting that, yes, they have faith in Indian surgeons as well as Indian medical system and Indian government, which government also worked very well in this. And they did a lot of efforts, even FICCI pitched in. And I remember that how much actively we worked together. So I think this is one of the latest thing that medical tourism, and it is shaping up so well, and people want to come to India rather than going to some smaller countries and getting their treatment done.
Yes, exactly. And I also think it's also very interesting, we are the largest, we're the most populated country, right? And everybody wants to come here to get that treatment.
Yeah. So that's true.
And I'll tell you why. Like for me also, I was staying in Canada, so for me, it's the cheapest.
Yeah.
I know that. I know the post patient care, the amount of procedures. This is going to be excellent. Even though we have a shortage of medical professionals, we know that if something's urgent, they will get it done. In a lot of countries, what happens is, we don't have a specialist available, wait for 4-5 months. But you don't know what's going to happen to your body.
Absolutely. You are so right. Absolutely. I was in US for some time, and my daughter had a problem, and she had a fall on a weekend. And it was so difficult for me to just get a surgeon, during that weekend to just get the small stitches. But here in India, the waiting time is very, very less. You go directly to the specialist. And we at Jeewan, we are very blessed, We have all the specialties, like I have all the multi-specialties and the super specialties, right? We are dealing with neurosurgery, the thoracic surgery, the plastic surgery, and gastrosurgery, so many. And even the super specialists and people like me who've experienced in gastrosurgery, laparoscopy, we are absolutely available there and then. So the decision making is faster, the surgeries, the time lapse is very, very less, and that's how the recovery becomes better. The diagnosis become better. So I think we are really blessed with the system is going on in India.
Yeah, no, that is very true. And as a highly trained surgeon and a board member of the Delhi University's governing body council, what role has leadership played in shaping the future of India?
I think everything, as I said, my initial time was all for learning, and I always believe that the more you learn, the more you are able to deliver. And then slowly I was blessed that I became a faculty with Johnson and Johnson. I started going all around. We used to go to different places, even in Punjab, in Haryana. I still remember very well. I had gone for a surgery in Punjab, and I was teaching a lot of people there. And it was written outside, that dil khol lo yaron se, nahi to khulana padega auzaron se. Things like this always inspire you, that they tell people that, you come out, tell your problems. So when you travel so much, when you're teaching, it's not only that I'm going for surgery, I'm going for the communication, for their questions, for their doubts. So if we clear those things, and that helps. And then slowly these things help you becoming a leader. What is a leader? Leader is basically who can tell you what to do. There are certain circumstances, there are situations when people want to know what to do. So I think that made me a leader, and those qualities helped me. I was really lucky that even the Delhi government helped me, and they wanted me to come up, and then I became the member of the Delhi University board council. And then I used to go to different colleges, like the Saraswati and the Delhi University colleges, where we used to go and be part of their board and tell them how to do things and what to do things. And I think that's a very, very good thing, that how I can participate in the growth of the country and the city.
And also just giving all your knowledge, passing on your knowledge onto the younger generation. I think this is something I'm very proud, as an Indian.
That's a great feeling, actually.
We love to pass on, not only it's very easy to pass on assets to the next generation. It's not easy to pass on knowledge.
But I think that is very, very gratifying what you said. With the most important thing is, when you do something, you are just doing it for yourself sometimes, or maximum for the patient. But when you teach somebody, or when you tell somebody, how to do it, that's how first you are increasing your own skills. They are even becoming better. I feel that's the main thing. And as they always say, one simple candle will light up a room. Darkness may be immense. When you light up another candle, that feeling, जैसे उसमें बोलते हैं, the thing is, अगर आप खुश हो तो दूसरों को खुशी दे सकते हो. अगर आप खुद को भूख लग रही है तो आप किसी को रोटी नहीं खिला सकते. The thing is, when I'm satisfied, I'm gratified by what I'm doing, that only tells me to help others, And I feel so good when somebody tells me that, you taught me this 10 years back when you had come there. That feeling is good.
And now, COVID-19, which now that you think about it, it's only been 4 years. I mean, it's been only 4 years when it all happened, but it just feels like it was yesterday. And how do you think, what all has the medical community learned from COVID-19? There were really great things like the vaccine, India being able to have its own vaccine, which was something, that was very, very great, to be honest. That was not a small thing to do.
Absolutely.
But also just, that a lot of people in rural areas did not have access to healthcare. Even in 2021, when we had the Delta COVID wave, there was not any space to bury the bodies, just because people were out of oxygen cylinders. And also because doctors and nurses were working day and night, but even then, that was not something that anybody could have prepared for. So what do you think the medical community has learned from COVID-19?
I think there also I'm blessed, because as a surgeon, I'm doing my surgeries, but I am running a hospital, right?
Yes.
And it's a 100-bedded hospital, it's an NABH hospital, and we have about 15 to 20 critical care beds.
Yes.
So what I went through was again very, very, it was very, very tough.
Yeah.
And I am really happy that my team worked with me day in and out. I mean, we were people, were 150 of staff members and people, the doctors, and we lost 2 lives also from our staff and this, which was very sad, you know. But we were sending SOS every night or every evening for those people to save those lives. And we could save so many. We saved at least 1,500 to 2,000 people just in our hospital. That was God's grace, you know. And then, you know what, it was definitely a learning process too. We started learning so many things. First, we learned the value of life, right? Then the government also said, and definitely there was a change. People started, you know, they started learning that doctors are important, and it's important to work as a community. You know, I worked with the MLAs, the MPs, the councillors, the police, and a lot of government agencies came front. I think they also did a great job, government also. And with these new vaccines coming up, India's name became very global, and people could see how things, you know, can be handled. So we learned a lot of handling of patients, how to, you know, help each other. A lot of science came in. We used a lot of new equipments. We used a lot of new sterilizers. There were so many things, and then we could use them later also. And especially the telemedicine, you know, that came up like anything. We were treating people at so much distance, you know. Now we are doing so many tele-OPDs and this thing. People at remote places, we are helping them. So I think it was a blessing in disguise that we learned this way also. So now it's become a regime, you know, that you can do a lot of telemedicine. You can help people at different places also. And then people became more bolder. They started valuing life more and became more bolder that, okay, fine, we need, you know, there are things which we should do, which we should not do. There are things like immunity, we need to work on that. So I think it helped us in many ways, but it was a nightmare, absolutely. And we worked very hard for it.
It was an absolute nightmare, and it was almost like a war, if you think about it.
And we were all warriors,
Yeah, and especially the doctors, you know, like they were kind of, you know, like the soldiers protecting us. Because I remember every day there would be a call. This person has passed away, this person has got a case.
Every day.
And it was just heartbreaking, you know. There were actually satellite pictures that there are no places to bury the body. And, you know, people lost livelihoods. And I also think that in a way, you know, the medical community, they work so hard. We got our, like, vaccine, you know, so many other things that now it's become one of those profound, like, experiences that will shape the future also. That if something like that would happen again, how do you...
So it you know, actually prepared us to how to manage the disaster.
Yes.
So now even the government said, and people like us also, our hospitals also, we are much better prepared for the disaster. We worked day in and out that time. We didn't have beds, oxygen was a problem, equipment was a problem, but we were managing everything and could save lives. And now we are more prepared for the future disasters, you know. In case anything happens, we know how to work, you know, and sort that thing out. So I think that way, but it was a very tough time.
No, it was very, very tough time.
Absolutely.
For everyone.
Absolutely. Every 1 hour, every minute was so important. Every life became so critical that time.
And I can't help but imagine, you know, like I'm not in the medical field. So for me, it looked very different than it looked like, you know, for doctors. For me, it was a very weird feeling where it was like I could not go outside. And if somebody has a case, you know, I should not go in that area. I can sit at home and I can watch Netflix or I can read a book. But there are people out there who are dying, but I can't help them. Even if it's in my own family, I can't help them. So for me, it affected my mental health in a very weird way, if you think about it. I want to learn more about how, you know, your mental health was affected, your team's mental health was affected, because this thing went on for 2 years.
Absolutely. So, you know, it was such a drastic situation that I could not meet my kids for about 2 to 2.5 months. They were at home and I was in the hospital. We stay nearly very close by.
So you were sleeping in the hospital?
Yeah, I was there. My team was there. We were wearing the kits. We were there, eating there only. And the worst thing was, you know, like out of 150 people, every day some 20 would fall down, 10 would fall down, that they are positive now, or they have got disease. Their kids, they could not see. Their places, they could not go. So we were arranging food, everything for the medical people also. And everybody went through that, you know, what you're saying, the psychological part. You know, the psychological part became so bad that, you know, for us, first thing was to make them positive about it. Like, this will end. Everybody used to think now this will never end and everything is going to finish. So they were going through that like anything. And as you said, people who were outside, they wanted to help. They were getting depressed because they thought, oh, my parents are there or my brother is there and I can't come to the hospital. They were not able to meet them. So it was a psychological, there was so much psychology behind everything, and people were so scared. That fear factor was so high. And everybody, after that also, I still remember those two lines that तनाव की हो गई है आदत इस कदर कि तनाव होता है तनाव ना होने पर. So people were like, is it normal now? Can I be relaxed? Can I do something else? That scared them to that level that people lost their livelihood, they were losing their relations. So I think the mental part was very, very important. You asked very correctly. First we wanted to increase their morale, and then they had to increase the morale of the patients and their relations, and we were getting calls for 150, 200 calls daily. What to do, how to do, should I come to the hospital? We were not picking up. If picking up, then a problem. And then similarly, the medical fraternity, they were together, but they were trying, everybody was trying their bit. And a lot of associations also come in, medical association also was trying how to help people. And then, so, that's how we came out of the psychological and the mental part also.
Yeah, no, I really respect the sacrifices made by, the doctors, nurses, and the...
Thank you. Yeah, I think that was really hats off to everybody.
That's what everyone, including the families, not
Absolutely.
being able, knowing that your parents are out in a basically like a war zone.
Absolutely.
And
they used to ask us that, why do you want to go? Like, can't you just close? I have my own hospital. So, the first thing I got from my parents and my children, why can't you close the hospital? But, I said, if I close the hospital now, I'll never be able to forgive myself. I'll not be able to face myself. So, I think to face it, like on the border and try to save people, that's, I think, the best feeling I can have.
Yeah. And what advice, would you give to all those people who are either, just joining the medical field, who want to go into surgery? Again, surgery is a very high stress environment. What mental health advice would you like to give to them?
So I think most important is, like as I said, my kids are the 5th generation, right? So yes. I used to take them to my surgeries. I used to show them my OT and my medical part, and I used to tell them that you have to decide on your own. Similarly, every child, every person who approaches me, or I meet them in different social things, so I also tell them, you have to decide. So my children were with me for 3 years because the things, as you said, have become very stressful. First, the surgical part, you're doing the surgery. Then there are the medico-legal part. Then there's the patient-doctor relationship. Then the diseases, how the course is. Then the treatments. So the point is it is divided into so many things. So it's become more stressful. And I think anybody who's coming in or joining, like my kids, they just got lucky they got into Delhi, both of them, because they worked very hard. But I tell them day in and out that this is just the beginning, So you have to be sure for a very, very long duration you'll be studying. Your mental level, your stress level, you really have to consider that, you have to be relaxed whenever possible. And you have to have one motto. As our hospital, Jeewan Hospital, has a motto of service to sick is worship of God. So I feel you have to have one inspiration. Yes. My grandfather told me a very simple line, when I joined. He said, purpose over name. Yes. And I still remember that purpose. If the new generation has a purpose to serve, to do a profession, definitely it will give you gratification, and to serve the people and to help them. I think that is the main thing I would tell them. And then definitely the passion is so important. For me, I wanted to be a surgeon. I'm pursuing my passion, so I'm very happy. Then I can face so many things. So I think psychologically and mentally, the most important thing is you have to look for one kick or one inspiring point, and maybe then 10 stresses can be dealt with that.
Yeah, no, that was
that's important.
Very nicely. And I also want to ask, you're running for the position of President of the Indian Medical Association South Delhi branch.
Yeah.
Now, what would you do? What changes would you like to make if you got elected?
I would just say, I'm remembering those two lines again, that एक तमाशा शोर का कल फिर से झेला जाएगा, एक इरादा उम्मीद का सांसों से ढेला जाएगा, कल तो तभी आएगा जब आज खेला जाएगा. So I think what is important is you have to be in it to win it.
Yes.
I'm also very happy running my hospital, and Jeewan has the names and so many branches in Delhi. But the important thing is that I want that there are so many problems the doctors are facing. Yes. We are absolutely dealing with the problem. Every time I get a phone call from a friend or relation or patient, it's about a problem. Yes. Right? So what about our problem? And as I said, if I'm happy, if I'm problem-free, stress-free, then I can work on others. So my concern and why I stepped into Indian Medical Association South Delhi branch was this one. It's a beautiful family we have. It's a lot of good people we have, a lot of senior people, a lot of different new energy also. And my thing is that I want the change. Because I believe that there are, see, my name starts with V, and I believe in three other V's. And for the first, the Hindi V, I would say, is the Vajood. So I want to work for the self-esteem and respect of the doctors. That is my main thing. Second, definitely there's a lot of, sometimes vindictivism, violence. I want to work against that. So I want the community to become more close and understand how well the people are working for you. And third, definitely my thing is that the vision is for the academics, for the new technology, for the new things. I want this to be a platform to, we get the latest. We get so many, we have robotic surgeons, we have, medical practitioners, we have the clinicians, the nursing home runners, the corporate people. There are a lot of different. I want to get them together, get them united, and then work on for the future. So
yeah, and I'm just going to ask you some follow-up questions on that. But I really like that you want all of them to be united. I think even as India, billions of people here, and we're a lot stronger united than apart. And I think that stands for anything important that anybody's doing. So my first question is, what problems are doctors facing?
So I think the first thing, as you said, is absolutely stress, which any profession would have. It may be with the lawyers also, with the chartered accountants also, with the politicians also, with the podcasters also, people like such great people like you who are working so well in different ways, the businessman also. But as I told you, we need to deliver there and then. Right? If a patient is there and I'm a surgeon, if I enter the OT, I can't have any excuse. I can't postpone it. I need to do it then and there. So that adrenaline part is immense, the dopamine part is there. These are the hormones which need to be balanced. So that first thing is that stress-free thing is very important. And then second, definitely there are agencies, there may be the government agencies, there are so many issues like the fire NOC, the MCT part, or the government rates and the government, the way the packages are, things are there. So then again, the government definitely has their own constraints. So I don't say that it's only government thing, but we need to sit down with the government and make them understand the costings and things, make them understand the licensing and things, and then understand, what things can be done. So that brings a lot of stress at different levels, Somebody running a small clinic and is said to be, take out some licenses and all that. That's fine. They should do it. Everything should be on paper. But what is the meaning of that? How we can express it, So these are the second part of the stress. And third definitely is, which I always feel, is that because of so many things coming up, sometimes they are being exploited, sometimes they are being just said. So that spoils the patient and the doctor relationship. That also brings the stress, the paperwork has become more rather than the understanding. So I really want that we should be working on that, and that should reduce the stress once we are able to do that.
Yes, no, you're completely right. I think, there should be some sort of partnership between, the private sector, the government, even NGOs. Because I think the goal is the same, to make people's lives better. Including the ones who save our lives.
Yeah, that's true.
It's not just one way.
It's so important. Absolutely.
Yeah, to make everyone's lives better. So I think there should be more working together of, different organizations, different sectors.
Absolutely.
To make sure that everyone does what they can do and there's no sort of extra pressure, because I'll tell you one thing, army men, government, politicians, like the head government, basically, doctors, they have, their lives are very difficult and they have this power, right? They can either save a life or lose a life. And, for me, it's I don't have to think about that.
Right.
I know whatever my decisions are, whatever my mental health is, it's not going to affect someone else's life. It will only affect my life. And not to in such a way that it would be like, save my life or lose my life.
Absolutely.
But for, again, where you are and all the work that you're doing, I think there needs to be a lot more collaborations. Because it's already a very difficult field, and to go through stress which can somewhat be eliminated.
Absolutely.
Through collaboration.
Absolutely. Very good idea.
Yeah, no, that should definitely be a priority.
Absolutely. I think that is so important because that collaboration would ease it out,
Yes.
And when you know that you are united in a different way, and when the government part is also there, the corporate part is there, the doctor part is there, that is very, very important. And that will be a very mutually benefiting thing for everybody.
Yeah, and I also, one of the problems with, the sort of Indian, let's say, like healthcare system, and even when it comes to education, not a lot of people have, access to these facilities, which is actually very sad, because if you think it's a right, right to education and a right for, like medical this thing. So what do you think should be done to, make sure that it is more accessible, that even people from rural areas
Absolutely.
can come and, they can access healthcare?
Yeah, I think it's a very good idea what you're saying, and it's a very good thought. So wherever I go, I've traveled also a lot. Every year I travel, and then being part of so many different organizations, I see the accessibility is far more difficult outside. Number one, if you see globally, anywhere in UK, US, where I've also seen and worked, the important thing is that there it takes time. They have a system. You will submit a general practitioner first, then he'll tell you whether it's required or not. Then the specialist would come when you would get the in this thing. Even for basic things, sometimes they tell you after 2 months, 3 months. Yes. So compared to that, in India, it's much, much better. Yes. And I'm blessed that, as I said, the Jeewan hospital, the main thing, how it has run for 100 years, is the accessibility. And accessibility is amazing. The patient would just come, and it will be a patient of all strata.
Yes.
We'll have patients who's coming in a Mercedes or a BMW, and we'll have a patient who's just come from Safdarjung at 3 o'clock because nobody saw him. So that part also, somehow or the other, the government has to see that bridging is so important. And especially those nursing homes, and the hospitals, the smaller ones also, the way they are trying to bridge it between the bigger and the government is amazing. Somehow the government also has to, put in effort and try to help them. And, they are bridging the thing, and they are doing things like, if I'm qualified from UK or US, and still I'm doing, my job at Jeewan, and I'm doing the surgeries maybe at the 1/3 of the normal rates pricing outside or here. So that is so important, and accessibility, as you said, is so important. The patient should just get up. He's already in pain and he's looking for some help. If he goes there, the government would have their own constraint. They are working very well. They are helping a lot of people. A lot of schemes are there. But still, if a patient goes there and there are 300 people standing in the queue and nobody is able to see him, so that's very difficult. Sometimes he's not able to, afford the bigger one. Then it becomes a big problem. So I think accessibility is the key, and that's how the hospitals like ours, the Jeewan Hospital, who are running it on their own without any help or any this thing, is the key for accessibility, where the patient can afford it and it's accessible.
Now, what are some challenges that the Indian healthcare system is facing that should be addressed urgently?
So I think the most important thing is what you were also mentioning is it is about collaboration. And I think after running a hospital, and I have seen different 4 decades, right?
Yes.
I saw 10 years my grandparents working for the hospital, then my parents, and then I worked, and now I see my children going to the medical college in Delhi.
Yes.
So, this is such a wide thing. So I feel why I have entered the Indian Medical Association South Delhi also, and I'm running for the president nomination, and this is this only because we need to collaborate. Maybe we have everything, but the collaboration is so important between the corporates, the nursing homes, then the clinics, right, and then the government. So if you see, there are widely, it is so divided that a person who's just running a small clinic, but he's a general practitioner for 30 years, that he matters to the patients a lot.
Yes.
They trust him blindly. A nursing home running for 100 years like ours, Jeewan Hospital, they want everything because they were born there, the grandparents were born there. So that is there, that USP is there. Then the corporates have their USP, they have good funds, they have good technology, good this thing, very good. People are going for that also. And then comes the government. The government hospital, they are doing well on their own. But who will get everybody together and the collaboration, and then it is very simple, that we complement each other, because, it's all about synergy. It's all about the resonance. So once that resonance is there, then India can be a bigger revolution.
Yes.
Right? And then it becomes such a convenient thing for the patient or for the person who's suffering. So I think that's the most important challenge. That's how out for the elections also. I want to be part of the the administrative part and do the Indian Medical Association thing, because already they are doing a lot of good things. But I think this will be a very, very important thing.
So I'm rooting for you to win it.
Thank you so much.
You know, a lot of doctors are again wonderful, but not a lot of them think about the big picture, as you say. And you're thinking about the big picture. You're thinking about legacy also. That when your kids are entering, what changes have you done? What are you giving them? What will they give to the future generations? So I really hope that all the doctors who have the power to vote, if I could vote, I would vote for you. But if other doctors would also, it would be really good to see all the changes that you bring about. And one medical innovation that you're very excited about, and something that you want India should have that kind of.
I think
innovation.
already India has taken a big leap, and everybody is talking about artificial intelligence. So I think AI is the thing, and I already have seen and I've tried that, the robotic part. So the robotic surgery, and then the AI being used in all the three things, pre-operatively. It helps to, we get all the records, all the tests, everything done and compiled, and that's so beautiful. Then comes the intraoperative part, that's the robotic, and then the third AI would be artificial intelligence, will be used post-operatively. So I think that is the thing, and everybody says, either you change or the world will change you. So it's better, I was doing general surgery and I was happy. I thought that's the thing. Then I started doing laparoscopy and I was happy. But now with artificial intelligence, I think we need to do that, and I see India going leaps and bounds with that.
And it's also really good that there are two types of people in the world: one who hate change, and the others who embrace change. And the thing about the times that we're living in today is that AI is not going to steal anyone's job. The person who knows AI will steal your job. And so it's very good to see that you're embracing all of these changes, rather than because sometimes people be like, and no matter their age, no matter their generation, some people just don't like change.
No,
And that is very sad. But the ones who embrace change, and the ones who are excited for that change to come, are very rare, and are like true leaders of that kind of industry, with this this motive to serve, which I think is really.
Absolutely. And I think अंदर वो एक जज्बा होता है ना कि ज़िंदगी की असली उड़ान अभी बाकी है, हमारे इरादों का इम्तिहान अभी बाकी है, अभी तो नापी है कुछ मुट्ठी भर ज़मीन, आगे पूरा आसमान अभी बाकी है. So I think that jazba, that there are a lot to be explored, lot to be conquered. That's so important.
No, that's very good. I'm gonna move on to the personal questions now. What are some of the challenges you've encountered while managing a hospital, and that too Jeewan Hospital is huge.
So I think the most important thing, as you said, is you need to know your priorities. Definitely, I am born in a family where I know patients. The hospital definitely is one of the most important priority. But I have always made sure that my family is also the biggest priority I have. So I've been always with my children. I've always been with my wife, and we've been always, talking about it, discussing. Communication is so important. Even if I'm not available, but my children know that why I'm not available. And when I come and I do compensate for that, that is so important. So I think that's how the personal life has been good, and I really thank my parents. They have always stood with me. They have practiced for more than 50 years themselves, and I've been doing my homeworks in operation theatre. I've been getting my preparations in labor room for my exams. So I've lived that life. So I know how much hard working they have been, and I think the key to that is walk your talk. If I don't need to tell my children what need to be done, if they see me doing it, then I think that's the best thing I can do.
Yeah, no, that's lovely. And what are some of your hobbies and interests after the the little time that you get after family and after the hospital and all the other Johnson & Johnson, G20? What are some of your interests and hobbies?
So I think somebody told me that the people who are the busiest, they have the maximum time. So I believe in that. Sometimes I would just sleep for 3 hours or 4 hours. But I have always pursued my passion, which is another passion is golf, and I've made very good friends because of that. And I was lucky that I won BMW India National, and I represented India. Yeah, I went to South Africa where I again finished top 10. So I think some passion is so important. And golf again, it always teaches you to be in character, to be, keep on fighting. So that helped me. That game, I used to get up at 3 o'clock and go and play
Yes.
golf at 4 o'clock.
The odd times, yes,
Yeah,
my
so
dad.
your dad, I know him so well, and he's been like that. So I think sometimes a passion is so important that you even work harder for that. There have been time like I've not gone and played for 3-4 months, 5 months. That's fine because priorities are there. The hospital, my children, then the Indian Medical Association. But I think I pursued that and I won so many tournaments. I could meet so many good people, and it gives you even a wider thing. As you said, leader. A leader is not somebody who tries to teach people. He's the one who's always learning, and then he's walking the talk and telling the people, yeah, I think this is the way to go. So I think it helps you.
And I think people who play golf, like my dad wakes up at 3 a.m. And then after that he'll go to office, and then after that he'll work for 12
Absolutely.
hours, and then he'll come. And then if somebody when my mom will say that, oh, it's fine, you've only slept for 4 hours, don't go tomorrow. It's like, no, I have to go for golf.
So I think that's the way. That's like your father, So I mean, he does business, he does so many things, but he still takes out time to play golf. So sometimes some passion is important. And then that helps your mind, that helps your body, and then you are even more, feel more fresh and more energetic. So that gives you that dopamine, that kick I said, is so important.
Definitely. And, if you could go back in time if you could go back in time and give your younger self one advice, what would that be?
I'm very satisfied right now, and I feel God has been very kind to me. So, but still I can't be saying that nothing went wrong or I could have been better. I always believe one advice I would always say, in my profession I have learned, in my surgery also, that do the thing what you can, and what you are made for. Don't try to do something more.
Yeah.
Right? It is better that you keep it for the next time. Other thing is, but whatever is possible, don't leave it for the, for some next day to happen. If you can do something good for the patient, in the surgery, just do it then and there. That's what I've learned. And definitely I've learned one more thing, which is very, very important, is that you need to prioritize at that time. Don't be in a dilemma. You will always have two things at one time. If you, जैसे बोलते हैं कि सोच के करो, but करने के बाद मत सोचो. So I think I've learned that सोच के करो, and just once you've decided to do one particular thing, it may be professionally, personally, then once you've decided, then do that, and then don't crib about it. So be positive. I think positivity is what I've learned in my life is so important.
Yes, be positive, spread positivity.
Absolutely. And I always tell a formula of dose. There are 4 hormones in our body. D is for dopamine, O is oxytocin, S is serotonin, and E is endorphin. So these are all positive hormones. These you get when you smile. These you get when you hug somebody. These you get when you are thinking positive and doing positive things. So we can generate those positive hormones in our body. We don't need to get depressed and take them in tablet form.
Yes.
So that I've learned that the most important thing is everything is inside. You just need to pep it up.
This is kind of a unique question that I like to ask on my podcast. What would be the title of a book based on your life?
Oh, that's very interesting.
Everyone says that.
So I think if I start thinking, there will be so many.
Yeah, it's the first one that comes to your mind.
But I think if a very simple one, which may be very stereotyped also, so I can always say that Jeewan hi mera Jeewan.
Oh.
So very simple one. So Mr.
Very profound though.
Yeah, and I just thought about it right now, and it's very spontaneous. And Mr. Jeewan was my great grandfather. And
So he's the one who started.
Yeah. So in 1921, this is more than 100 years, he just listened to Gandhiji and he said Swadeshi. And he said, now from today, he was a very simple railway master, and he said everything and everybody in my family would be doing everything for the country and for medicine. And that's the day now we have 154 doctors, 5 generations. So I think Jeewan hi mera Jeewan doesn't only mean Jeewan Hospital or Mr. Jeewan, but I believe that if I put it in English, then life is what you live. I think that should be my the English version of my book, because life is not hypothetical. They say legends are never made by fortune tellers, but what you've done in your life. So I think that should be the life is what you live, or Jeewan hi mera Jeewan.
I love that. It's so profound.
Thank you so
And
much.
thank you so much
Thank
for
you so
coming
much.
on the podcast. It has been, very inspiring to hear about all the work that you're doing. And I wish you best of luck for everything that you want to do in the future.
Thank you.
And I know the country is in great hands.
Thank you so much. Really, I am honored to be here. It's my pleasure, and you are doing amazing. May God bless always. Thanks
Thank
a
you
lot.
so much.
Thank you.